where we spill the tea on HITea. I'm thrilled to be here in sunny Las Vegas at the Health Conference, interviewing leaders that are in the health information technology industry. So tell me, what are some trends you're hearing in the health hallways, and who are you and what do you do?
So I'm Michael Dalton. I'm the CEO and founder of Ovatient. We are a virtual care delivery company that's built on Epic, and we provide continuous care, really a virtual patient-centered medical home to health systems that are on Epic as well.
I love that. So who are the type of folks that really work with you most?
Usually, when we're working with a leader at a health system, it's maybe their director of virtual care, it could be their from an operations and ambulatory perspective, chief strategy officers that we're working with to be able to build out our care delivery offering, even connecting with access centers. So we have regular meetings with the access centers at our customers to be able to provide an opportunity for care that's connected when a patient's calling in, they're looking for a visit. We're able to provide them with real-time access to our templates to be seen. At the same time, if they're in MyChart, they're able to come through their website. I like to say it's no wrong door, no dead ends. However that patient prefers to be able to engage.
And so amazing to do it right there.
Yeah, absolutely.
What an amazing option for people to be able to have that access to that. And is that within the halls of the hospital setting, or that's at home, or anywhere?
It's really at home, at work. It's really built around where the patient is.
That's awesome, fantastic. So what's an underrated challenge in healthcare that you have been thinking about that you wish had more airtime?
One thing that we're really focusing on is being able to provide whole person continuous care. Oftentimes in virtual care, you have some level of segmentation, and they think about patients as conditions instead of continuous care. That's why we provide that virtual primary care along the continuum. So I like to say there's not these verticals. When we're talking about people, we say virtual care that's entirely human. We need to think of them across their entire care journey. So it's not just a women's health sector, a men's health sector. We're taking care of all the care needs that you have, and we're helping you navigate across that journey. It just happens to be done virtually, and then we get you connected to care that we know you're going to need in person. Maybe it's a lab draw, imaging, or a specialty visit. But our job is to be that kind of that Sherpa or that steward of that person's care, their co-pilot.
So inspiring. Now, what trends are you hearing about in the health hallways?
Can't escape everything that's talking about AI, and really I think the proof is in the pudding, and you need to be able to go in and see what is the solution. We, being built on Epic, have largely relied on what Epic is going to be rolling out, but I really have heard more about an approach around weight management, starting to see outcomes that providers or vendors can start to point to. I think we've really gotten to a proof point where if it's payers, employers, everybody's feeling pressure. And so you need to be able to demonstrate outcomes. So I think that's the one thing. It's great to talk, and you hear this opportunity talking about the solutions that are there and being able to bring care to the customer or to the patient. But I would say the purchasers of these solutions, they're expecting that you can demonstrate what you can do at this point.
Interesting, very interesting. Now, my listeners love to hear about what's going on in the space, but they also love to learn about leaders, about what drives them.
Yeah.
So if you could give your younger self a piece of advice, what would you tell him?
So the advice that I would give is really to be curious. And for me, that was something that, be persistent, do not back down, be able to continue to explore. And so what you may have gone to school for is not what you're destined to do. And it's not really something that's going to put a permanent stamp. So continue to be curious, continue to learn, continue to explore. And for me, that opened a ton of doors, and I would encourage other people to do the same.
Love it. Now, how can my listeners find you online?
So you can go to ovatient.com, or you can check out our LinkedIn. We have almost 10,000 followers there. We post a lot from the team. That's really important, not just to talk about Ovatient, but really to give a platform for our team to talk about what we're doing, the care that we're providing, and the impact that we're making.
Wonderful. Thanks for joining me today. I loved learning from you.
Thank you, Chris.